Hello again, and welcome back to week one, part two of Rogue Medicine Unleash Your Inner Doctor. Today, we're going to be talking about comprehensive metabolic panel. And the comprehensive metabolic panel is usually about 14 tests that are done as part of most doctors' sort of annual screening. Some doctors will run a more brief metabolic panel, but that's usually the shorter metabolic panels are usually done in a hospital setting when things need to happen faster and they're looking at very targeted tests to try to determine why somebody's out of it or not regaining consciousness or things like that. It is a big test, and it is such a big test that it left me wondering if I bit off more than I can chew in this first week, covering a blood count and a metabolic panel. It was one of those moments for me where I thought, these are so sort of intuitive to me after running them for so many years that they seem simple. However, trying to explain them and break them down is more complex. So if you have feedback about that, let me know. The metabolic panel, comprehensive metabolic panel, is a big test. It covers your sugar, it covers kidney function, it covers your liver function, and more. So, and now as I'm doing this, I realize I forgot to put one slide in here. I'll go back and add it later, so it will be in your slideshow. Okay, so let's get started with glucose. So glucose is your blood sugar, and your reference range that you're going to see on the lab's reference range is for a fasting blood sugar. I have a lot to say about this, but I'm going to keep it short because we're going to talk a lot more about blood sugar in depth in week 4. But basically, your optimal range needs to be less than 85. The reference ranges that the lab is going to have for blood sugar, they keep getting more and more ridiculous. It's almost like we're normalizing a pre-diabetic state, and I am 100% not okay with that. Having people walking around with like low-key metabolic illness and metabolic dysfunction is not good. Anyways, walking around with prediabetes for years is damaging to your system, and normalizing prediabetes, normalizing diabetes, normalizing metabolic disease, it's just one of those things that system-wide makes me think, wow, we're really creating great customers that are going to be dependent on medications for the rest of their lives. So I shall step off my soapbox now and just say that an optimal range for fasting blood sugar is 85 or less. You know, if somebody's at 87 and their other measures look good, you know, maybe that's okay. But I'm getting a little off topic, and I want to talk about this more in week 4. So I'm just going to leave glucose at that. All right. So next, we're going to talk about kidney function. Kidney function is really complicated. There is a lot that goes on in the kidneys. And kidney function, when my patients' markers really start going out of whack, that is one that I am completely comfortable referring to a nephrologist or a kidney doctor and co-managing my patient with them, because kidneys don't bounce back like your liver does, and kidneys are complicated. So, you know, that's one of those areas where a specialist maybe is a really good person to have on board. All right, let's talk about creatinine first. So creatinine is a measure of kidney function that's related to muscle breakdown, the muscle breakdown that happens with muscle contraction. So this measure is going to be dependent on the muscle mass of the person. And the creatinine that's created from this muscle breakdown is cleared through your kidneys. So your optimal range is going to be 0.8 to 1.1. And if you have a functional elevation or sometimes an overt elevation, out of the optimal range or out of the lab's actual reference range, it can mean that you're dehydrated. And I do see this quite frequently, especially with those fasting blood draws. And I talked about that a little bit with your blood count. With those fasting blood draws, you don't eat for 8 to 12 hours, and maybe you didn't drink as much either. I've actually had patients who, oh, poor things, they'll come in for their blood draw and they'll be like, Dr. Belt, I didn't eat or drink for 12 hours. And I'm like, oh God, no, you can drink all the water you want. And that usually leads to their labs being off, and also maybe not the most pleasant scenario for drawing their blood. Okay, so elevations can also happen in creatinine if you have kidney disease. For men, if you have BPH, which is benign prostatic hyperplasia, and that's an enlarged prostate, a benign enlarged prostate. It's interesting with the elevations in creatinine, if they're out of the optimal range and you have symptoms of BPH, those symptoms are going to be having trouble initiating the urine stream, having trouble starting or stopping urination, waking a bunch of times to pee at night, dribbling urine, interrupted stream of urine, and erectile dysfunction. And some things I'll look for if I'm suspecting that somebody has the beginnings of BPH, and they're just starting to display symptoms. If your BUN, which is the next marker we're going to look at, and electrolytes are normal, that might indicate that you have BPH. But sometimes those monocytes that we talked about with your blood count, those might be elevated too. So just little things to tie together to clue you into that. Now, with this kidney disease, I did forget to mention that if kidney disease is present, you're usually going to have other kidney markers that are abnormal. Your BUN, which is the next one we'll talk about, your GFR, which is another one we're going to talk about. And if you get a urine test done, the specific gravity of that test is going to be off as well. So now, the other thing that can cause elevation is a urinary tract congestion or obstruction. You might see this more with female patients. We tend to get more urinary tract infections, and that can cause a temporary elevation of creatinine, because of that inflammation. This is, I don't see this often. And I think it's because it's usually transient, right? If a woman has a urinary tract infection or some kind of bladder inflammation that's obstructing her urinary tract, I usually don't check blood at the same time. I'm usually checking urine to see if they have a urinary tract infection. So I don't see this often. But again, the BUN and the electrolytes will be normal if the urinary tract is congested or obstructed. Your creatinine can also be elevated with uncontrolled diabetes. One of the outcomes of diabetes is going to be kidney damage. And, diabetes, like hypertension, is often a silent killer because you often don't get symptoms that you can feel until things have progressed pretty far. So it always shakes me up a little when I have a patient who won't change their diet and their diabetes just keeps going and going. And then bam, we see an elevated creatinine. And I'm like, oh no, we're starting to really see the kidney damage now. And sometimes it'll turn them around and sometimes not. All right, decreased creatinine is usually related to decreased muscle mass. So a lot of times I will see this in older women. You have the kind of body type of an elderly woman where they kind of shrink down and they get small and frail and they lose a lot of muscle mass. So that usually tells me that there's a need to exercise and a need to build some muscle mass. Sometimes it can mean that there's a more serious process going on, like muscular dystrophy or multiple sclerosis. But in those cases, you're going to be usually under the care of a doctor anyways. Okay, so let's move on to BUN, blood urea nitrogen. And blood urea nitrogen is a measure of this urea here. Urea is formed in the liver, and it is the final stage of protein breakdown. So if this is increased or decreased, well, if it's increased, it can mean two things. It can mean your liver's producing too much urea, or it can mean that your kidneys aren't clearing the urea well enough. Now, this is usually something we use to measure kidney function, and it can be one of the earlier indicators of kidney disease. All right, so optimally, you're going to see a kidney function or a BUN of 10 to 16. The lab reference ranges are a little wider than that, but we're trying to keep you optimal. And again, we see these elevations with dehydration, with kidney disease, along with other abnormal markers. Now, one of the things that I would like to say around kidney disease in terms of support for kidney disease, CoQ10 is an excellent kidney support antioxidant. So don't sleep on that one. If there's kidney issues, CoQ10 is generally very safe to take. I will give up to 400 milligrams per day of CoQ10. Milk thistle, as people think of it as a liver support, but it also does really good things for the kidney. And hydration is always important. A lot of times people with kidney disease run around with some low-level dehydration, and that's just contributing to their problem. I also have a tincture at the office. It's called Two Treasures, and it's made by this company called Heron Botanicals. And that has done awesome things for people's kidneys. And I know I think you might be able to get on their website and take a look at that. I think you can, Heron Botanicals, but they're Two Treasures, your kidneys are your two treasures. That tincture, it rocks. So herbs can help for sure. Every time I talk about dehydration, it makes me thirsty. Okay, other things that can cause your BUN to be elevated. If your adrenals are hyperfunctioning, so if you've been really stressed out and you're pumping out a lot of cortisol, which is one of your stress hormones, it can cause some extra protein breakdown. So, that protein breakdown happens, your liver produces more of it, your kidneys are trying to clear it, but we might see it creep above that 16 there. So yeah, if you've been under a lot of stress, you've been feeling tired and wired, those are things that might indicate that your adrenals are pumping out a lot of cortisol. And then we have drugs that can cause an elevated BUN, prednisone or the steroids. Prednisone is just the most common one. And then diuretics. So those drugs that make you pee more, used usually in the management of high blood pressure or swelling. So something like Lasix or hydrochlorothiazide, those would be examples of diuretics. All right, so decreased BUN can occur with low protein diets. I usually see this with a vegan diet. It's easy to get away from protein when you're vegan. It's not as accessible to your body when you're not eating like an animal-based protein. People on low calorie diets, and then that would expand to include elderly folks who don't have much of an appetite, or anyone who doesn't have much of an appetite and who's eating just a low calorie diet that's not rich in protein. So you're making less urea because your liver doesn't have to break it down. Okay, so speaking of the liver dysfunction can also cause decreased BUN. Usually this is going to be a functional issue, something that's keeping you out of these optimal ranges. So I'm not talking about necessarily cirrhosis or anything like that. I'm talking about, slow detoxification processes, And you can support your liver on that level with liver supportive foods like beets, burdock, your cruciferous veggies like your broccoli, cauliflower, Brussels sprouts. Um, Turmeric's a great liver support. Burdock root is another liver support. Um, oh, let's see. Glutathione is a good one. Milk thistle is a good one. And then just avoiding the things that are going to toxify your liver, like highly processed foods, fragrances, molds, those types of sort of environmental toxins. Okay. And pancreatic insufficiency can also cause your BUN to dip under that 10. Your pancreas makes enzymes, and with those decreased, if you're not making as many pancreatic enzymes, it can impact the thoroughness or your ability to break down your protein. So things that you might want to look for that would indicate pancreatic insufficiency would be undigested food in your stool, excessive fullness post-meal. Yes, you should feel full, but I'm talking about fullness that seems out of proportion to what you just ate. Gas, bloating, indigestion, diarrhea, those things can indicate pancreatic insufficiency. And we can support pancreatic enzyme production by taking digestive bitters and or just taking pancreatic enzymes. I usually like to try to get the body to make the enzymes on its own, but sometimes we're in a pinch and it just can feel better to take the enzymes. Okay, kidney function, last but not least. Glomerular filtration rate. And it's your EGFR, your estimated glomerular filtration rate. Optimally, we're looking for a level of greater than 60. And this is the best way, the most sensitive way to look for kidney disease. And there aren't really elevations of this one. It's not like you're going to be filtering too hard with your kidneys. So what we're really looking for in terms of kidney function are decreased EGFRs. Chronic kidney disease, let's see. Now GFR, I've seen it decreased with dehydration. I've seen we do lose some of our capacity to filter with age. And this measure is the most sensitive one, and it's actually used to stage kidney disease. So what stage are you at with your kidney disease? Kidney disease staging is done from 1 through 5. 1 is the most mild, 5 is the most severe, and means the person is going on dialysis. Let's see. Now, if you have low GFR, high blood pressure, protein in your urine, you need to see a kidney doctor just to check to see if kidney disease is present. So, those three together are usually going to indicate that you at least have stage 1 kidney disease. Let's see. And like I said, I co-manage this with a nephrologist. I also think it's important to point out that the reference ranges that the lab's going to provide are different for African Americans. It's just one of I don't know if there's any other measure that in a common lab test that would, sort of outline things by race. But African Americans do have a different, sorry, startled my dog. They do have a different reference range for this one. All right, let's move on and start talking about our electrolytes. And our electrolytes are going to be sodium, potassium, and chloride that we're looking at on lab work. And, if you get an electrolyte mix, it's going to have other minerals in there, like it'll have a little magnesium and things like that. But for lab testing, these are the big 3. So first we're going to talk about sodium. And elevated sodium is actually pretty uncommon. A lot of times the optimal range is 135 to 142. If I see an elevated sodium, it's more than likely just like 1 or 2 little clicks above normal. And it's due to dehydration because they've been fasting and not drinking enough water. Now, With sodium, um, it can also, increased sodium can also indicate that your adrenals are working too hard and pumping out too much cortisol. Our adrenal glands are also, they're also responsible for our mineralocorticoids, which they're responsible for regulating those electrolytes. And that's kind of what that means without getting too techie about it. Now, if your sodium is more elevated than just a click or two, a lot of times you've been having vomiting or diarrhea, or you've been excessively sweating. Now, there is a rare condition called Cushing's that's an autoimmune adrenal gland condition that can cause sodium to be elevated. What else do I want to say about that? Okay, so let's talk about low sodium, and then I want to tell you why sodium is important to a certain degree. Low sodium can be due to low salt intake. We really restrict our salt because we've been told to by the powers that be, because it contributes to high blood pressure. But I think in my whole, years of practice, I've only seen that happen twice. People have increased their sodium and their blood pressure's gone up. Most of the time, high blood pressure, in my experience, is not related to you eating too much salt. It's related to eating too much processed food and not getting a balanced level of your electrolytes. All right, soapbox done. Adrenal hypofunction. Let's talk about that one. That's when your adrenals have been functioning at a high level for a really long time and then they just can't go anymore. Adrenal hyperfunction and hypofunction, we can get a lot more clarity on those two conditions if we do a little bit of salivary adrenal testing. I use a specialty lab, but salivary adrenal testing can actually be done through LabCorp, which is it's a lab that is everywhere. And you take your salivary sample 4 times throughout the day, and it gives you your reading of cortisol. So it's a great test to do. If you have low blood pressure, if you have chronic fatigue, weakness, dizziness, you don't recover well after you've been sick or after you've exercised, or you crave salt, your adrenals might be running low. Your adrenals might be running high if you have, high blood pressure, headaches, hot flashes, you feel wired, or maybe you have some excessive hair growth where you wouldn't normally, which generally applies to women, but sometimes that can impact men too, that excessive hair growth. All right, so let's jump back to your decreased levels of sodium. It can be caused by swelling or edema. Edema that results in low sodium sometimes is caused by early congestive heart failure. It can be caused by low thyroid, and it can be caused by kidney disease. So if you have chronically decreased levels of sodium and you have an inkling of any of those, you might want to go get that checked out. Congestive heart failure can be stopped in its tracks, if not reversed, if you get it early enough, and the same with kidney disease and thyroid disease. And Addison's here at the bottom is another one of those rare adrenal autoimmune conditions that causes your adrenals to function incorrectly, and it results in low sodium. I do want to say that sodium, it's the base of our blood, right? It helps us to maintain acid-base balance in our blood. It helps with the way our nerves fire. It helps with the way our heart beats, our kidney function, and of course our adrenal function, which I've talked a lot about. Now, and it's interesting because if an elderly person goes to the hospital and they're kind of out of it, especially when they haven't previously been out of it, one of the common reasons, a more common reason is because that sodium gets too low. So, as much as we love to say sodium is bad, it's not. It's necessary for life. I like to think that processed foods aren't good for us. And one of the reasons for that is because they load that crummy, that crummy salt source in there. And you all know, if you see me on Instagram or anything or read my emails, that I love Redmond real salt because it's a real food product. And there's other salts out there that are great too. Okay, moving on from sodium, we're going to talk about potassium next. And potassium is a major pH buffer inside of our cells. Again, it's important in nerve transmission. It's one of the electrolytes that controls, or one of the factors that controls, the rate and the force at which our heart contracts. So our bodies keep sodium in pretty tight control, because too high or too low, we're going to start having irregular beats of the heart, and that can kill us. It's not good. So optimal range for potassium is 4 to 4.5. The lab ranges, are broader than that, and they're more of the, if you're above or below this, we've got a big old problem. All right, so elevation of potassium we often see with dehydration, those darn fasting blood draws. Now, elevated potassium, if it's above that 4.5, unlike our sodium, can mean that your adrenals are functioning at too low a level. So low sodium, high potassium can mean that you maybe need to take a salivary adrenal test if you're fatigued, if you're weak, if you're dizzy, if you're craving salt, those things. So now, let's see. Elevation of potassium can also mean that there's some kind of process going on with tissue destruction. My dog really wants me to play with him right now. Oh boy. Sorry about that. So if your potassium is elevated and you can't figure out a cause, definitely seek higher care, because there could be some kind of tissue destruction going on, and you might need help figuring that out. Stop. Sorry. Okay, decreased potassium can mean your adrenals are functioning hyper. So you're really pumping out a lot of cortisol and pushing that stress hormone pretty hard. And we talked about that. So then if your sodium is high and your potassium is low, and you have those high adrenal symptoms, you might want to take that salivary cortisol test or get someone to order it for you. All right, so decreases in potassium might also mean you're on diuretics, which are the drugs that make you pee. Hydrochlorothiazide and Lasix are two really common diuretics that waste potassium. Potassium can also be decreased if you have high blood pressure. And then I meant to put that not with a bullet. It should be over here in a category by itself. But we do get some false elevations in potassium if the tourniquet's been left on the arm too long. That can falsely elevate your potassium. Or if in the tube, any of the red blood cells ruptured, that's called a hemolyzed blood sample, and that can falsely elevate your potassium too. So a lot of times on the lab report that I get, I don't know about you in your portal, it will say this blood was hemolyzed, and that may impact some of the report, some of the lab results. So if your potassium is elevated and it hasn't been in the past, you might ask your provider or ask the lab, if they don't tell you, if they can tell if that sample was hemolyzed. All right, let's talk about chloride briefly. Chloride will almost always move in the same direction as sodium. So if your sodium's high, your chloride's high. If your sodium's low, your chloride's low. Generally, your optimal range is going to be 100 to 106. Elevations happen with dehydration again, adrenal hyperfunction, tissue destruction. I think that's incorrect. I think I accidentally left it on there from potassium. I will fix that in the slides when I get them to you. All right. So Decreased is going to be, again, decreased adrenal hypofunction. But interestingly enough, if your chloride's low, it could be an indicator that you have low stomach acid. If you think of hydrochloric acid being the acid in your gut that helps you to break down protein and things like that, not having enough of that substrate might cause you to have low stomach acid. Here is where I forgot to put a slide in, and this slide is for calcium. Calcium, I'm just going to talk about it with the electrolytes here. Calcium is important for muscle contraction. It's important for blood clotting, your heart function, nerve transmission. And it's really important that your stomach have the proper acidic pH in order to absorb calcium. That's why hydrochloric acid in your stomach is so very important. It's not just there to give you heartburn. It's there for really good reasons to help you absorb your minerals, to break down your protein, things like that. This is why we should not be on acid blocking drugs long term. Acid blocking medications are really meant to be used for 6 or so weeks and then discontinued. But we see people on them for decades, and then we see these people getting osteoporosis later, unfortunately, because they're not absorbing their minerals. Okay, so optimal calcium is going to be 9.2 to 10, and calcium is regulated by a hormone called parathyroid hormone. These little glands that sit on top of your thyroid that make parathyroid hormone, and both elevated or decreased levels of calcium need to be tested further, and probably the parathyroid hormone needs to be evaluated. All right, elevations of calcium, parathyroid hormone needs to be checked. So I would definitely recommend that you seek higher care in that case, just so you have somebody with, a greater breadth of knowledge to help you dial in on what's going on, because parathyroid glands can have tumors and they can be abnormal, just like other stuff in our body. Elevations in calcium can also indicate that your thyroid's low. Decreases in calcium can mean your parathyroid hormone is low, so you should seek higher care for that. Decreases in calcium can also mean that you need calcium. Calcium citrate with vitamin D is good. Calcium carbonate is crap. And if you're on an acid reducer with low calcium, that's another thing to think about discontinuing, would be your acid reducer. I know in my office, Dr. Paul does a great job getting people off of those things. I do want to say that calcium citrate with vitamin D, while it's a good way to increase those calcium levels, if you're looking to strengthen your bones, just taking calcium and vitamin D is not the key to that. Bone health is just more complex than get your calcium and your vitamin D in. Our bone strength there's some nuance to it. There's other minerals and other things that need to be considered if we're really wanting to help with strong bones. And that's one of those cases where you can really tell that, I'm not trying to be insulting, but you can really tell that a medical doctor only got like 3 hours of nutrition training or however much they get, because they just kind of miss the boat nutritionally, and they'll recommend just take calcium when you really need somebody who understands the nutrition around bone health better than a typical medical doctor would. All right. So the other thing that low calcium can mean is poor absorption. Those acid blocking medications, maybe digestive bitters to get those digestive juices going would be a good idea, or maybe some digestive enzymes to help with absorption would be good. All right, let's keep moving. Let's move on to total protein. And your total protein is going to be comprised of albumin and globulin, and we're going to talk about those two subproteins next. Okay, your optimal range is here, and elevations are usually due to dehydration. And if it's decreased, I start thinking of poor digestion and a low protein diet. I always ask people, are you eating enough protein? Are you eating enough protein? Are you eating enough protein? Yes, I had an egg with my oatmeal and I'm like, oh, that's not enough protein. So, or maybe they're eating a lot of protein and they're just not breaking it down well enough. So then we start talking about digestive function. If some of our other liver markers are off, which we'll talk about coming up very soon here, we might also think about liver dysfunction. And let's see. Okay, so let's talk about albumin. And albumin is one of our major blood proteins, and it's mostly produced in the liver. And it transports hormones, it transports some drugs around. So I always think of albumin as the one that it's just a carrier protein. So it carries stuff around. And it should be around 4 to 5. Elevations of albumin, again, can be due to dehydration. Decreased levels due to low stomach acid. Again, we're not breaking down our protein enough, to be built up into those serum proteins. Liver dysfunction. We do see decreased albumin levels in pregnancy, not necessarily a negative, but if you're pregnant, it'd be great if you were under the care of a doctor or a midwife. Sometimes low albumin can mean that you need vitamin C. And then in extreme cases, low albumin can mean that you are overtly protein malnourished, not just kind of out of the optimal range, or you have cirrhosis and alcoholism and you just can't break down protein anymore. And you can't produce that albumin anymore. Okay, the other portion of that total protein that we just talked about back here is globulin. And let me turn my page here. Okay, globulin are also transporters of substances in our blood. They also make up our antibody system and some of our clotting factors. So globulin is a little bit different than albumin. We don't tend to make as much of it. So your optimal range is 2.4 to 2.8. Let's see. Yeah, and elevated levels could indicate low stomach acid, liver damage. We're talking about, elevations out of the lab's reference range, and maybe if you're above 2.8, it could be an early indicator of fatty liver, hepatitis, cirrhosis, or some kind of immune activation. Like maybe you have that could be an inkling that maybe you're dealing with some kind of autoimmune process. So if you suspect that you're catching something like fatty liver early, that is not that hard to reduce on your own. But the immune activation and kind of diving into that autoimmune, that immune system dysfunction, that might be best if you partner with a naturopathic doctor or a functional medicine doctor to sort of take that leap and dive in deep to that, especially if you're having symptoms or you have a family history of autoimmune disease. All right. Decreased levels could be due to digestive inflammation. So those chronic digestive issues can lead to poor protein breakdown. So then you just don't have the substrate to make globulin in your liver. Or immune insufficiency. If there isn't a known reason for your immune system to sort of be subpar, you can always think about things like chronic viral infection, environmental toxicity, including mold toxicity. And I don't care where you are. I don't care if you are in Arizona. Mold toxicity is absolutely a thing. I've seen it over and over again. There could be other reasons that your immune system just isn't up to par. Okay, let's talk about some liver enzymes, some liver function tests next. ALP, alkaline phosphatase. I meant to write that in there and I didn't, but it's easier on your lab report. They're just going to have the initials. They're not going to write out alkaline phosphatase. Optimally, that measure is going to be between 70 and 100. Alkaline phosphatase is an enzyme that's found in the liver, yes, but it's also found in the bone, the intestines. It's also found in the placenta, and I believe the skin as well. So it's found in a lot of places. It's grouped with the liver enzymes because we make a fair bit of it. We find a fair bit of it in our liver. So elevations can mean biliary obstruction. And what that means is all of the things in your liver that carry bile, your little bile ducts, your big common bile duct, your gallbladder, there could be some obstruction happening there. And that can be because of a gallstone, but that can also be because of inflammation, kind of causing some pinching down and obstructing those passages of bile. ALP can also indicate liver cell damage. And then we start diving into the bone part. It can indicate bone loss. Elevations can indicate bone fracture or bone growth. So I don't think I've ever seen a child, if we happen to take blood, who hasn't had an elevated ALP, and parents freak out. And I'm like, no. If they didn't have elevated ALP, then I would be freaking out because their bones are growing and turning over. So this measure should be elevated for a kid. Same with fracture. If somebody had a fracture and their ALP wasn't elevated, I'd be worried that they weren't repairing that fracture. Okay. Oh, bone loss. I'm sorry. I was gonna expand on that. Something like osteoporosis, rickets, which is rare. Rheumatoid arthritis will sometimes involve some bone loss and cause an elevation of ALP. And also, if you have cancer that's spread to the bone and is starting to break down that bone, that can also cause elevations in ALP. All right. Decreased, which I see a lot. I almost never see increased ALP. Decreased can mean that you need zinc, and that is the case for a lot of people. Zinc need, if somebody's dipping below 70 and they start eating more zinc or start supplementing with some zinc with food, always, we'll see that ALP come back up into range. Also, there's this autoimmune form of anemia that causes B12 deficiency. It's called pernicious anemia, and that can cause decreased ALP as well. Okay. Now, if your ALP is elevated, there is further testing that can be done that can tell you where. So you can look at ALP that's produced in the liver, the bone, the small intestine, which is another place that it's produced, and get a better idea of why that's elevated. So that's important to know. And it's important to know, you could always self-order it, but if your ALP is elevated, that might be somewhere where you want to seek higher care. And you want to make sure that your doctor is ordering those ALP, what they're called is isoenzymes. Because we need to know why that value goes high. All right, let's talk about AST, aspartate aminotransferase. So AST. This is another enzyme, and it's present in the liver, the muscle, the heart, the kidney, the lungs. It's present in a lot of places, mostly in the liver. Now optimally 10 to 30. I will say that the hepatologist, the liver doctor, doesn't really get worried about AST until sometimes those liver enzymes are triple their upper limit. So they have a very wide range that's acceptable, whereas with optimal range, we just tighten that down a bit. Elevations can mean that your liver cells have been damaged or that they're dysfunctional, as in the cases of cirrhosis, hepatitis. If you're having issues detoxifying, you can have an elevated AST. Excessive muscle turnover or breakdown, a training injury, a trauma to a muscle can cause an elevated AST. That should be temporary, and as things heal, that should go down. The same with mono. Mono due to Epstein-Barr virus or cytomegalovirus. You should be able to see that go down as the infection resolves. Also, it can be elevated due to heart issues, maybe if somebody's developing congestive heart failure, sometimes due to atherosclerotic changes in the vascular system. So be aware of that. Decreased levels, B6 deficiency due to poor nutrition, due to poor absorption, and alcoholism. Alcoholism can also cause a B6 deficiency, so that's a little bit like peas and carrots right there. All right. Now, let's talk about ALT, alanine aminotransferase. Again, our reference range is 10 to 30. That is an enzyme that's mostly present in the liver, but it's also found in skeletal muscle, your heart, and your kidneys. With liver dysfunction, your ALT will usually be more elevated than your AST. ALT, think liver. I like little mind tricks like that. Okay, so elevations can mean liver dysfunction, fatty liver, which, fatty liver. So fatty liver, we used to almost only always see it in alcoholics because, alcoholism causes liver damage. But now what we're seeing is sort of this epidemic of non-alcoholic fatty liver disease. I've seen it way more frequently now than I have in the 10 to 15 years ago when I almost never saw it because I don't really see that many alcoholics. But wow. And it's because people are walking around with these high blood sugars and their metabolism is sick. They're not able to control their blood sugar. They're walking around with high insulin, which is causing their liver to be damaged even in young kids. 10-year-olds, 12-year-olds, 15-year-olds are walking around with fatty liver. All right. And again, we have that biliary tract, and we'll talk more about fatty liver in a roundabout way when we talk about blood sugar during week 4. Biliary tract obstruction. We talked about that before. It can be a gallstone. It can be, a more systemic liver problem, but you're going to have symptoms with biliary tract obstruction. So if your excretion of bile is obstructed somewhere, it's usually accompanied by nausea. It can be accompanied by gallbladder attacks, by an intolerance to greasy or fatty foods, pain between your shoulder blades. That's a referred pain sort of from your gallbladder. Light brown stools or yellow stools can be symptoms that your biliary tract's obstructed. And I will say, if you want to work with somebody to help you get rid of gallstones, that is a good idea. That olive oil thing that people do, drinking olive oil and then pooping out gallstones, that's not a real thing. When you drink olive oil and you poop out green balls, you're not pooping out gallstones, you are pooping out congealed olive oil balls. So, it's not necessarily a bad thing. It's just not producing the result that you might want. So work with a qualified person to, if you're looking to get rid of stones, to do that. All right, ALT can be elevated with cirrhosis as well, and also with muscle breakdown, kind of like we talked about back here with your AST, muscle trauma, and injury, things like that. All right, decreases in ALT are going to be similar to AST, B6 deficiency and alcoholism, and confusingly enough, early fatty liver. So, I see much more of an issue with that being elevated. But, if your ALT is 3 or 5 or 8, you might have an issue with early fatty liver if you're not an alcoholic or have B6 deficiency. Okay, we have one more to talk about. This is long, and that's why I wanted to break this into 2. And that's why I thought during week 1 I bit off more than we could chew. So Thanks for bearing with me here. All right, bilirubin. Bilirubin is formed from the breakdown of hemoglobin. And if you'll remember, hemoglobin is what carries oxygen within your red blood cells. So when those red blood cells are done with their life cycle, which is about 90 to 120 days, bilirubin is formed when our bodies break down that hemoglobin, and we excrete it through the liver. So you'll see our optimal range is 0.1 to 1.2. And elevations of bilirubin can mean that our bile is moving sluggishly through our liver, especially if you have some of those symptoms like nausea, pain between the shoulder blades, gallbladder attacks, light-colored stools. You can't eat greasy or high-fat foods. That might indicate that you have obstruction of the biliary tract or just sluggish bile. And I really, sometimes taking bile salts can really help if it's just sluggish bile. Obstruction is usually a little bit more difficult to get underneath, but sometimes just giving ox bile or bile salts can really help with those symptoms of, your gallbladder attacks and those light stools. Again, liver dysfunction, which we've talked about a lot, and then increased destruction of red blood cells. If you have high bilirubin, it might be worth seeking higher care just to ferret out why that's happening. If you're destroying your red blood cells inappropriately, that could be a great big deal. And then there's this really rare syndrome called Gilbert's syndrome. It's not really rare, it's just kind of rare. And that's a genetic condition where the body can't clear bilirubin. And it's pretty benign. It just raises the alarm bells when that bilirubin's elevated. And decreased levels, I have never seen a decreased bilirubin of less than 0.1, ever. I've been in medicine, if you count med school, over 20 years, and I've never seen it, but decreased levels might suggest an insufficiency of the spleen. That, for me, is a theoretical thing because, like I said, I haven't ever seen it in real life. Okay, we are done. Thank you for bearing with me. I hope you made it. I hope if you felt like you were going to fall asleep, you paused and you came back later. If you have questions, bring them to the live session or submit them to my email, drbeltsander@gmail.com. Next week, we will be back. This was by far the biggest week. Everything else will be a lot more manageable as far as the lecture, the lecture length, and then just the understandability of the material. So bear with me. I'll think about how to tweak that for next time, I run this course because I think we can make some improvements with it and make it not quite so overwhelming. So anyways, everything from here on out will be more manageable. I hope you have a good week, and I hope to see you at the live. And if not, submit your questions. Bye.